Joined. Outstanding timing, team. Thank you very much. I'd like to welcome everybody to the BHA Rules Stakeholder Engagement Kickoff. If you've been with us before, you know that we've done other town halls and done some other stakeholdering. I'm pleased that we have the opportunity to re-engage with key groups of people to continue to improve our BHA draft rules. My name is Tom Miller. I am the Division Director for the Quality and Standards Division with the Behavioral Health Administration. My pronouns are he, him, his. I will take the next slide. Thank you. I would like to start by reading the BHA values of truth, equity, collaboration, community-informed practice, and generational impact. Likely, if you have been with the BHA in any of our previous rural town halls or other kinds of provider convenings, you have heard these BHA values. It is particularly important that I share them again with you today because, as you probably know, we've had some personnel changes here at the BHA, but I want to assure all of you that these values remain central to all the work that we do as BHE staff and employees, and in particular within the safety net team that's doing the drafting of these rules, that we challenge ourselves each day that we do the drafting to make sure that we include these values and principles in our work. Next slide. With that, I'm going to turn it over to Victoria Lasky, and then we will go around the members of the safety net team that have been the primary drafters. Victoria?
Thank you for that, Tom. And as we go through our staff introductions, would encourage you all to introduce yourselves in the chat with your name, pronouns, and who you're representing today, if that's an organization, lived experience, etc., as we go through our staff introductions. My name is Victoria Lasky. My pronouns are she, her. And I am the Associate Director of Safety Net Licensing at the Behavioral Health Administration, and I will pass it to Mariana.
Thank you, Victoria. Good afternoon, everyone. My name is Mariana Sears. My pronouns are she, her, and I am one of the Safety Net Licensing Managers that is helping with the rule redraft. I will go ahead and hand it over to Mel, please.
Hi, everybody. Thanks so much for being here. My name is Mel Tyler. I am a Safety Net Licensing Manager with the rest of the team. I will be running the slides today, so you won't be seeing my face a whole lot. I will pass it over to Erica.
Hi, everyone. Erica Gannett, Safety Net Licensing Manager as well, and I will pass it over to Jenna.
Looks like Jenna may be having some technical difficulties. So in that case, we will continue on with going through this agenda. So today we will not be talking about rules in particular, but rather talking through the upcoming process to review new rules and provide feedback. So we are going to be giving a legislative update in our new rules timeline, walking through an outline of our rule chapters as that outline has changed since we last engaged with you all. And then also, most importantly, walking through our stakeholder engagement calendar and opportunities. So we'll be really breaking down all of the different events that we're offering, what type of format those are, who those are for, what the targeted audience is, and what will be covered in those meetings. So that's really our focus for today. It's not rule language in particular, but more doing a kickoff to this, as I think Tom said, rule stakeholder engagement 2.0. Next slide, please. Some housekeeping items for today. As you may have noticed, this video will be recorded and posted on our Laws and Rules web page. BHA staff will have access to the chat and transcripts to ensure that comments are captured. Please share whatever you are comfortable with in this venue. Use that chat to let us know what questions or comments you have. We are also joined today by American Sign Language interpreters from Masterword. So thank you and welcome to Adrian and Audrey for their time. Please let us know if there are any technical issues with seeing the interpreters throughout the session. And I see Mariana just posted our link to laws and rules in the chat if you would like to take a look at that webpage. You can use the chat to engage with us today. We also have our email inbox open that is on the screen. We have a Google form and survey response, and you are welcome to raise your virtual hand if you would like to speak with us. Next slide, please. All right, so now we are ready to dive in. As of last Thursday, House Bill 23-1236, the Behavioral Health Administration Implementation Update Bill, has passed. And within that bill is a change in timeline for rules. So we are talking about rules for the Behavioral Health Entity License, the 2765 designation for involuntary services, and the safety net provider approval process. So previously in law, that timeline had been for those rules to be effective of July 1st, 2023. And now the new effective date will be January 1st of 2024. Next slide, please. So what that really means for these rules in this process is that we are able to reopen stakeholder engagement through June 23rd. So we have planned a full calendar of events in May and June, virtual and in person, to cover all chapters and include targeted stakeholder groups. Again, we will be walking through that. That's really the bulk of our presentation later on. We will continue to accept written comment through the rules in email inbox or our survey that will be open until midnight on June 23rd. And we have updated behavioral health entity safety net in 2765 chapters available now on that web page and that link that Mariana put into the chat. So those are available now for your review. This new timeline means that we will be getting our rules to our Attorney General's office for their legal review starting July 1st. So opening stakeholder engagement through June 23rd, then the safety net team will take a week to incorporate all stakeholder feedback as appropriate into the rules. Then they will be undergoing their legal review. You can expect to see us at the State Board of Human Services for our first reading of the rules in September. For those who may be new, maybe this is your first meeting with us learning about this rulemaking process. We have to go through at least 2 readings of the rule with the State Board of Human Services, who ultimately decides whether to adopt these rules. So we are having that first reading at State Board on September 1st. And then we are going to take the month of October to incorporate any changes that are needed based on that first reading at State Board, and our second read at State Board will be November 3rd, with that effective date aiming for January 1st of 2024. Next slide, please. And I will pass this one over to Tom.
Thanks, Victoria. Hello, everyone. Again, some quick 2765 designation updates. Start with the basics. 2765 refers to involuntary care. Primarily, we use the term 2765 as it speaks to that specific section in Colorado revised statutes. So to level set there a little bit. As many of you probably know, House Bill 22-1256 created several different changes within that 2765 Colorado revised statute, really did so in 3 different parts. The first, which was to take effect and did take effect August 9th of 2022, and speaks primarily to new rights, who can place M0.5 holds and when screenings have to be conducted. The next part, which was to go into effect this July, or rather July 1st, 2023, is the part that Victoria was speaking to in terms of being moved back for timelines. So that part of the statute is moved back to January 1st, 2024. The remaining section, or that third section of law that was to go into effect July 1st of 2024, continues to be the same. So probably the things that are in people's minds primarily are, when is the Behavioral Health Administration going to start training for some of the changes? When are the M forms going to be completed? And I have a few tentative timelines for those two things in particular. We are looking at starting to roll out that training on October 1st of this year, even though some of the timelines have been backed up. We know that there are questions out there, particularly from providers, but also people who receive services. We do have a new associate director of the 2765 program on board. Her name is Jessica Bell. So she is leading that charge. We didn't give her any time to adjust at all. We made her start doing this right away, and thank you in advance, Jess, for all your good work. So those trainings will start in October and pick up where our past and dearly missed former associate director, Laura Ferguson, left off. With regard to forms, we are making good progress on those M forms. We are working with our attorneys general to revise those forms that are court facing, and should have the majority of those reviewed and edited by the end of the month. And for those forms that aren't court facing, we are also making good progress on those and should have those done at roughly the same timeline. We plan to roll those out for initial review through the Mental Health Advisory Board. And then we are also contemplating sharing those draft forms on our website as well. So those are the updates that I wanted to share, and we look forward to engaging in more specific involuntary care 2765 designation updates as we do our tour and additional town halls throughout the state. That's it from me. I think we can move to the next slide, and then I believe it's over to Mary Anna.
You are correct. Thank you very much. So I will be the licensing manager, talking a little bit high level about some changes that have been made to our rule chapters and the structure of our actual rule volume that we're putting forward. And as Victoria mentioned earlier, this is a little bit of a challenging scenario to plan for, because we have a number of stakeholders who have been with us this whole time, and they're really familiar with what was put forward several months ago. And then we have some new stakeholders that we're really trying to bring along in this process, who are just getting started with the new rules in general. So what we're going to do is provide a little bit of an overview about how the current structure of the chapters builds, and definitely would encourage anyone who's reading the new rule volume to look at it from essentially a clean slate perspective, so that we don't get confused with a bunch of different versions that we had a few months ago. That is a bit of feedback that we received to the BHA, was that there were multiple versions and it was a bit confusing to follow. And we are actively working on making sure that we have the same versions that are working at the same time, and going forward to make sure that we're all on the same page. So as you're looking at this particular rule chapters and how they build, you will notice that we have trimmed down from the first number of chapters that we had to right now. You will have about 15 chapters to look at. Some of the chapter numbers and the content has changed since the winter, if you have been monitoring this process going forward, but some of them have remained the same. So chapter 1 and chapter 2, really, if anything changed there, it'll be content related and just reading through to see if any specific rules or expectations have changed, but the numbers remain the same. Chapter 3 and 4, were the new ones that we're putting forward right now were just posted a day or two ago. So there's hot off the press, new information that you can read there. And we'd love your feedback on our behavioral health safety net approval process, as well as care management. And then chapter 5 remains outreach, education, and engagement. One thing to highlight on this slide, as you can see with these asterisks, care management and outreach, education, and engagement are only applicable to comprehensive community-based behavioral health safety net providers. So as you're looking at these chapters, those will only be applicable to those particular types of providers. Next slide. Okay, so this is where one of the more, I think, exciting changes comes into play, at least from my perspective, because I was part of helping with this. So going into the second half of our rule chapters, recovery supports remains where it was, chapter 6. But you'll notice if you were part of this process before, that from chapter 7 and on looks a little bit different. I just saw difficulty hearing me. I'm going to lean in. Is that any better? Okay, sorry, Rhonda, that was a direct message. I apologize. If anyone has trouble hearing me, please let me know and I will try something else. You'll notice looking at chapter 7, instead of just having outpatient services, we have bundled outpatient and high intensity outpatient services into the same chapter. This was something that was done at the request of multiple stakeholders based on the way that our structure might have unintentionally or either created or reinforced silos and might have been a barrier to care. So there were efforts to combine those two chapters together to create a more fluid flow for the individual receiving services outpatient. On a similar note, chapter 8 is residential services. This one also, we received some feedback about making sure that it did not create unintentional silos. So between these two chapters, we've made a lot of progress towards building a continuum of care that builds from start to finish, early intervention services all the way through the highest level of residential services that we monitor to. When you're looking at this, you might see that withdrawal management is no longer its own separate chapter. That is because that particular service has been integrated where it belongs along that continuum of care. So if you were looking for ambulatory withdrawal management services on an outpatient setting, you would look in chapter 7 for those requirements. If you're looking for withdrawal management in a social withdrawal management setting, that's an overnight service that would live in chapter 8. So hopefully when you have a chance to look at these chapters, you will see that there's been a significant effort to make this more of a continuum of care, reduce silos, and make it a more fluid process for individuals and providers. Chapter 9 goes into crisis and emergency behavioral health services. And this one I will highlight is up on the website. There are 2 different versions that have been posted since April of this year, just with a quick update. We did want to make sure that the most recent one is the one that we highlight today. So please make sure that you are looking at the version that is effective May 8th. It has a note at the top of the chapter that says that it has been updated, and it includes updates to crisis stabilization units and ATUs. Chapter 10 goes into involuntary commitment services as well as emergency commitment services for SUD services. And next slide. And then the rest of these did not change as far as their order, but the number might look a little different. So chapter 11 is now services for children and families. Chapter 12, gender responsive. Chapter 13, outpatient competency restoration. And like we said before, that is only applicable to comprehensive community behavioral health safety net providers. Chapter 14 is criminal justice, including DUI involved individuals. And then chapter 15 is our 2765 designation for involuntary services. Next slide. So for those of you who might have a controlled substance license or be involved with recovery support services organizations, you might have noticed that is not part of what we're targeting right now as far as this rule process. That is intentional. And what we are doing right now is prioritizing the endorsements and the licenses that are statutorily required in this immediate period of time. So the behavioral health entity license and its related endorsements, the safety net, and the 2765 designation. Controlled substance licensing and recovery support services organization licenses will be revised in a later review process. And the nice thing with that is with controlled substance licenses, there is new federal guidance expected imminently, anytime now this summer. And we can actually incorporate that with that revision without having to cause additional stress and extra time at state board. I think that is it for me. So next slide. And I'll hand it back to Victoria.
All right, thank you for that. Now the announcements we are really excited to bring to you today, which is our stakeholdering calendar for the next 2 months. So we have heard that there's a desire for all different types of engagement, including in-person, virtual, opportunities that are more educational or presentation based, as well as opportunities that are more discussion based and listening sessions. So having received all of that feedback and having this additional time to re-engage, we are all very excited to do that with you all over the next couple of months. And you are invited to any and all of these opportunities as they are applicable to you. So I'll start out with talking through the in-person stakeholder engagement listening sessions. These are discussion-based sessions, so very minimal presentation, more of an opportunity for folks to come and share their thoughts, their questions, their concerns about specific rules or about system challenges they have encountered. And we are wanting to sit down with you all and engage in person to hear those. So we have those dates included here. Our first one is this Friday, May 12th from 10 a.m. to 12 p.m. in Denver, specifically in Glendale at the Colorado Department of Public Health and Environment. We do have on the link that's been put in the chat, the laws and rules webpage, there is a nice calendar on there where you can see the address and the specifics and how to register for those in-person meetings. We tried to, again, with a relatively limited period of time, just May and June, we are trying to get to as many corners of the state as we possibly can. So you'll notice that we have different locations that are really representative of the state. So we will be in Breckenridge, Tuesday, May 16th at the Summit County South Branch Library. We are working on dotting some I's, crossing some T's as far as the venues for these meetings. And we actually have a couple of these that just got finalized this morning. So please keep an eye on the calendar for the specifics as far as where these meetings are located and their specific times, but we do know those days, and we do have a Google form where you can register to let us know you're coming. We are not checking names on that list. Even if you do not register in advance, that is totally fine, but we like to just have an idea of about how many people we are expecting at each of these meetings. So you'll notice that on the calendar. The other thing I want to let you all know that is in process, we received a request for a version of the calendar that is easier for a screen reader to read. So we are working on a version that is listed out all of these events and how to participate. So, or for those who use screen readers, or for those who just prefer that type of a format, we will have that out to you shortly. Next slide, please. In addition, we have virtual opportunities for stakeholder engagement. So the next few slides will be those virtual opportunities. We will have detailed chapter reviews in town hall formats. So those of you who have been on this journey with us for a little while may remember back in December and January, we hosted a weekly series of town halls where we really walked through the proposed rules section by section to talk about the rule language in there. So again, this is more of a presentation or educational based opportunity, and with times for question and discussion, but it's going to be more on the presentation as far as ratio wise, more presentation, smaller pieces of time for discussion. And this is great if you are just joining the rules party at this point. This is a great opportunity to learn about these rule chapters, what is being proposed, and asking any specific questions that you have, bringing any feedback to those meetings. We are listening and open to feedback in any of these venues. There is advanced registration. These will be Zoom meetings. They will be recorded and available for future viewing on our webpage. And we do have the calendar here. One thing that is nice here is that we are going to be covering less content in more meetings than we did this December and January. So we will have more of that time for questions and discussion. We did receive feedback that those meetings, there wasn't enough time for the questions and discussion. So listening to that, we've got these spread out across 6 different meetings. And again, because of CSL and RSSO, we have less content to cover. So we should be able to do an overview of these rule chapters and have an opportunity for some discussion in there. Those are all 2 hours long. And again, you can see those dates there, and those are also on the calendar on our webpage. Next slide, please. Another virtual opportunity that we have, and this is sort of the virtual version of our listening sessions. So we are calling these rules office hours. These are discussion based. There is no specific agenda. There is no presentation. This is an open space to bring any comments or questions regarding the rules. So we have 2 of those opportunities, one in May and one in June, and those are each for 1 hour. Next slide, please. We also have a number of meetings for specific groups where we are going to cover topics specific to them. So that includes our lived experience meeting series. So these are going to be more discussion-based. Advanced registration is not required. We are going to have 2 lived experience meetings conducted in English, 1 in Spanish, and 1 in American Sign Language. So this is really an opportunity for those who with lived experience of a behavioral health condition, for loved ones, for those who have received services in the state of Colorado, to come and share their experience and what they're really needing from our behavioral health system. So those are the opportunities for lived experience that we have offered. We also are holding substance use disorder provider meetings as more discussion-based. The reason we have this one is that for those who have been following along for quite a while, back to 2019, the behavioral health entity license was really envisioned to have 2 phases. So we're right now in phase 1, where mental health providers have that BHA license through the Department of Public Health and Environment. And phase 2 was bringing substance use providers into that fold as well. So recognizing that this is going to be a bigger shift for those who have not previously been licensed as a BHA, we wanted to offer specific opportunities to engage with substance use disorder providers. In addition, we have a withdrawal management provider meeting scheduled and a 2765 designated provider meeting scheduled. Next slide, please. I also want to take the opportunity to highlight our laws and rules webpage, which has been dropped into the chat several times, and let you know what you can find here. So as was mentioned earlier, you can find our updated rule chapters. Those are all updated as of April or May. We have our person-centered summaries. So we took each chapter and wrote a person-first explanation of what that chapter really means to someone receiving services, and really explaining the content of that chapter and the purpose of that chapter. We have information about how to submit written comment. So our email inbox, which we monitor daily, and the feedback survey, where you can provide specific rule comments to through either of those ways. We would love to receive written comment from you all. Again, for those who may not be as familiar with the rulemaking process, all of the comments that we receive, whether those are in writing or in these meetings, we compile and respond to each of those comments. And that is included as part of our rulemaking materials that go to the State Board of Human Services as they consider our rules. So please know that when you submit a comment, that we are taking that into consideration. We are including that in our rulemaking materials, and we would love for you to write to us. We also have the rules stakeholder events calendar, as I mentioned, and we will have that list version of that available on the webpage soon as well. On that calendar, you can find registration links, locations, a description, again, of whether it's more discussion-based or presentation-based, so that you can know what to expect going into that kind of meeting, or choose the type of meeting that most interests you. We have the licensing transition resources, which include our behavioral health entity fast facts, our flow chart for determining if your agency would be considered a BHE, our testimony and response from the March layover reading at the State Board of Human Services. So if you provided written comments to the State Board in March, or you came to the first reading and provided oral testimony, we compiled all of that, and we did make some changes to the rules based on that feedback. That's reflected in the chapters on the website. And we also have a separate document that lists the comments and then our response to it. So that's available there. And also we have plenty more to come, but that's what you can find on the webpage today. Next slide, please. All right, that was the update we had prepared for you all. So we would love to take the opportunity to open it up for any questions that you all may have. Feel free to use the chat or raise your hand, and would be happy to answer whatever questions you have. Yes, I see a hand from Blair.
So if my license renewal is before all this goes effective, then I'll be under the old stuff until I renew then again?
Yeah, so just to ask a follow-up, if you don't mind, Blair, are you speaking about are you currently licensed as a BHE through CDPHE, or are you talking about a license through the BHA, like an SUD license?
I do the DUI classes, so, behavioral health. It's been over the years. It started out as ADAD and then went to Office of Behavioral Health. Now I think it's Behavioral Health Administration.
Gotcha. Thank you for that, Blair. That helps me answer your question a bit better. And I will answer this. And also, Tom, if you want to provide any additional commentary, let me know. But for our providers who are licensed through the BHA, through that substance use disorder license, whether that's DUI providers, other types of substance use providers, you will maintain your license through the end of your license term. And then once it is time to renew, you will be renewing as a behavioral health entity. So it will be a transition at that period, at that point in time.
So let's just say my renewal's tomorrow. And so I renew tomorrow. And then these rules go into effect January 1st. Am I going to have to renew again then? Or, and because the new fees are going up significantly compared to the old fees. So I'm trying to not only budget, but trying to see how much I got to prepare for what's coming ahead. So if I renew tomorrow or I renew before the effective date, how long am I good for before I fall under the new stuff?
Thank you for that question. Very important question. Glad you brought that up. So my understanding is right now we are issuing our SUD licenses on a 1-year term, and I'm going to pause and look at Tom to make sure I'm getting that correct.
Yeah.
So we are renewing those licenses on a 1-year term to create kind of a natural ramping up period. We don't want to create a situation where providers are dropping everything and renewing on January 1st, nor can the BHA take on that kind of amount of work all at once. So we're kind of trying to create this transition year where you will apply for your renewal. It's upon applying for your renewal. So in that specific example you gave, it would be May 2024 that you would be renewing your license with the BHA, and that's when you would be falling under the new rules. We will be maintaining our current rule volume through that transition year. So you will still be subject to the rules you are subject to now until you're transitioning over to the BHE license. And I also want to address that fee concern that I heard as well. We are working on some alternatives to the fee schedule that currently appears in the rules. We are expecting to have that proposal out to you by June so that you can take a look at that as well.
Okay, so I think I got it. But if I could just follow up, because so let's just say everything goes effective January 1st, 2024. So if it was on December 31st I renewed, I would still be under the old, and then the next time coming around in December 31st, 2024, I'm under the new rules and new fees.
Yes, that it would be up until January 1st. Renewals will be through the current regulations. Yeah, you got it.
Thanks for helping me out.
Of course, yeah. And we're going to, I know this isn't the specific scenario you're in, Blair, but we are also working on some specific guidance for specifically those who are BHEs through CDPHE right now. There are a lot of questions coming up around what does that mean? When are we transferring over? And we are currently working on drafting that guidance specific to BHE transition. So if you're sitting in the audience today with a similar question, but your question is, what about if I already have a BHE? We will have some written guidance to address that soon.
I'll jump in just real quick with that. We had done some good planning with our state partners, Colorado Department of Public Health and Environment, for the, now I'm pleased to say, past state of transition of the behavioral health entity licensing authority. So if people remember when we were talking about if a currently licensed BHE facility with CDPHE, the license expired prior to July 1st of 2023, that facility would renew with CDPHE. After July 1st would do that renewal or initial application with the BHA, as the BHA would start to get that behavioral health entity license at that point. We can really take that same approach, that same concept, and slide it back in time 6 months to January 1st, 2024. So the same thing, if you're currently licensed as a behavioral health entity with CDPHE and your license expires prior to July 1st, 2024, renew with CDPHE. And as Victoria pointed out, she and Kara Johnson-Hufford, who I believe may be on this call, are working together to do some frequently asked question, technical assistance kind of advice, and really follow in the footsteps of the great folks at CDPHE and get those on our website to do some of that technical assistance. I think in order of questions, at least that I saw first, and forgive me if this is out of order, maybe Anne?
Yep. Ann Knudsen, I had a question, and I'm really sorry if you answered this at the beginning of the meeting. I hopped on a little bit late. In regards to the changes to 2765 involuntary commitment, I know there were some rules that went were supposed to go into effect August of 2022. Do we know if they've been extended along with the rest of the extensions with that bill? And how trainers and having trainers ready for this process, if that's been affecting that at all?
Thank you for asking that. I did do an overview of that, but could probably have been much more clear in terms of that information. So that law had 3 different timelines in it, and the August 2022 timeline was not affected by the BHA implementation bill and its various amendments. So that provision of the law was not affected. It's currently in place. And I recognize that part of what the Behavioral Health Administration was to do under that part was in particular do trainings. We are hiring those folks, and we expect that those trainings will start in October. So I think I've said it several times, and it bears repeating in this setting as well. I'm sorry we are running behind on that. It is one of our top priorities to get that information out there and begin those trainings. Did hire a new 2765 Associate Director, Jessica Bell, who's leading that charge for us.
Okay, thank you.
Yeah, thank you for the question. And if you have any other questions, feel free to contact me directly.
Thanks, Tom.
Yep. Edie, I think you might be next.
Thanks, Tom. Edie Sun with the Colorado Behavioral Healthcare Council. Just wanted to touch base on something we've talked to your policy team about. One of our members identified just as the BHA bill was going over the finish line, what we think is a typo relative to that transition date from CDPHE to BHA licensure. So it inadvertently seems to create an overlap of a period of time where both BHA and CDPHE would have authority over the licenses. And it's our understanding that your policy team got a legal opinion saying that the legislative intent of House Bill 1236 made clear that BHA authority trumps CDPHE once those licenses come on board. But it would be really helpful to have that in writing so everybody really understands that. So Victoria, you mentioned that you're still working on the guidance about the BHE licensing transition. If we could be sure to have that addressed specifically in that document, I think that would put a lot of minds at rest.
Thank you for that, Edie. I think you're out in front of me in terms of what it does sound like was a technical error in the drafting. And Edie, I'm sure you know, we were doing amendment drafts late into the evening, several nights in a row. Yep. I think it might have been several, maybe 7, in fact, amendments to that bill that were keeping us all up late at night. So I think that's exactly the right approach. I think we put FAQ clarifications on our website. I think we should talk with CDPHE to make sure we're on the same page in terms of the way that authority operates. And assuming that we are on the same page, we'll get that out there.
Thank you very much. Really appreciate that.
And thank you, Edie.
I saw we had a few questions come into the chat as well. One was a request for a flow chart for when the BHE requirements go into effect based on provider type and when your license expires. Thank you for that suggestion, Kevin. We can definitely work on that written guidance that feels in conjunction with our BHE transition guidance. I think, per Blair's question earlier, there's also a need for guidance for providers with different license or designation types as well. So thank you for that suggestion. We are happy to take any suggestions for what would be a helpful resource for you all and can do that. There were a couple of more in the chat. This one I'll pose to you, Tom. So this was a question from Andrew. For agencies who receive a provisional designation, I would say provisional designation or license between now and the end of December, will they need to comply with the new January 1st rules, since their actual like full license or designation will start after January?
I want to paraphrase to make sure I understand. Are we talking about a facility that has a provisional license now?
So Tom, this is Andrew. Howdy.
Oh, hey, Andrew.
So hi, we're going through our designation process right now. We have our first meeting with Barbara actually tomorrow. So I'm
great.
thinking, yeah. So if we get it, let's say next month or the month after, then, or sometime this fall. So we are an outpatient behavioral clinic going to get our behavior or a mental health license and SUD or behavioral mental health designation and SUD license. So I'm thinking, okay, do I need to start prepping for 1/1/24?
Yes, I think I understand the question. Thank you for paraphrasing. It takes me a moment to get all the scenarios in my head.
Yeah.
If you apply now and receive a provisional or a regular license now, then the rules that apply are those that are currently in effect, the ones that you are intimately familiar with. The new rules won't apply until they become ratified and effective by the State Board of Human Services. So again, we anticipate January 1st, 2024. Quick sub note, we do have to go to the State Board and present those rules. There will be open testimony for those rules. So it is ultimately up to the State Board to vote and make those effective. So I just make that sub note. We don't anticipate any trouble, but that's again another reason that we're re-engaging with stakeholders. We believe that that was part of what was missing the first time around, is we did that too quickly. So, but back to your question, Andrew, I would hope that answers, and then also add, agencies are frequently concerned that if there are regulatory updates and there is some adverse action happening with the license, what rules are used if there's adverse action? Now, not suggesting that your agency would ever have that happen, but just in case this is occurring to anyone else. So if there's adverse action, the rules that were in effect at the time that the adverse licensing action was taken would be the rules that the facility would be held to. Now, I probably went too far afield. Let me go back to your original question and my answer and see if that helped.
Yeah, I think it helped. I think the way I'm interpreting it is that whenever we have a site visit, they're going to be using whatever rules that are currently approved by the board.
That is correct. And so I think in your case, since things seem to be moving along very quickly, it's going to be the rules that if you click on the Secretary of State website that are currently in effect, that you're going to have to operate in conformity to. And that January 1st, assuming again that the rules become effective, you will have to educate yourself and work with your licensing manager, in this case, Barb, to come up to speed on those new rules. And then let's say you get that SUD license sometime this summer, let's just say January 1st, it will be issued for 1 year. I'm sorry, not January 1st, July 1st. And then the following July, we would reissue that as a BHE with an SUD endorsement.
Gotcha. Thank you so much.
Thank you, Andrew, and good luck with everything.
Yeah.
I see we have a couple more questions in the chat. First, I will read a fellow Victoria's question. We just renewed our SUD license, but we also have our controlled substance license, or CSL. When renewing our license in ladders, it wouldn't let us choose to renew our CSL. Is that because rules are changing so imminently, or is this another issue I should bring up to our regular state contact? I don't see any reason why you should have an issue renewing your CSL at this point. So I think that's probably a technical issue on our end. If you could follow up with me, I can get you to the correct contact and we can make sure that that's resolved. I will put my email in the chat as well. And then I saw there was one, I think I missed one that was a little bit earlier from Riley about states struggling to keep mental health professionals, have lowered the certifications for providers to maintain federal compliance, lower credential levels to maintain federal compliance so they can continue to bill. And the question is, are you raising any of the certification levels for the professionals treating people? So generally, certification levels and what's within the scope of practice for a professional is the territory of the Department of Regulatory Agencies, or DORA. So none of that is contained within our rule. We're really not proposing any additional certification levels or anything outside of current state for what is in, essentially these are, and this is something I often neglect to say, but is important to note, these are facility or agency level rules. And so these are going to be applying to that agency as a whole, not speaking to specific scopes within a license or certification.
If I could just emphasize that point, I think Victoria pointed out something so important and something I think that we at the BHA need to be better at, and that is saying in the initial parts of our conversations and presentations that what we are talking about is facility license. It sounds formal, but we say that to distinguish between when we give a business license for a facility or an agency to operate versus licensing an individual to have a practice. Now, it may seem like there's overlap at times because we have specific requirements for certain kinds of licensed staff within our facility license regulations. And at times, facilities may submit a regulatory waiver to us to say, can we use a different level staff for a particular kind of purpose or service rather. But again, to Victoria's point, that doesn't mean that we have control over what the Department of Regulatory Agencies requires in terms of a particular licensed professional. That's all in Profession and Occupations, which is a division at the Department of Regulatory Agencies. So thank you for the question, and Victoria, thank you for making distinguishing that in terms of the different license types.
I think we've gotten through all of the questions that I've seen in the chat, and it looks like we've got about 5 minutes left together today. So are there any additional questions that folks have? Feel free to raise your hand or use the chat. Going to give it a few more seconds in case anyone's typing. All right, well, it was great seeing such a huge turnout today. Excited to see so many others who are just as excited about rules as we are. And we will look forward to seeing you and our in person in our various opportunities virtually. Please check out our webpage and our calendar. And we look forward to re-engaging with you to co-create this behavioral health system in Colorado. Thank you very much. Have a great day.